On behalf of the Centers of Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Julie Cahoon and I work for Kaufman & Associates. I will be the moderator and facilitator for today's webinar. Today's webinar is Supporting Tribal Long-Term Care Heroes During COVID-19 Pandemic. Before we begin, I'd like to highlight the main features of your webinar interface. First is the main window where you see the PowerPoint slides. To the bottom right of the window is the Q&A pod. You can enter a question for our presenters at any time in the Q&A pod. A Q&A session will take place after the presentation. If you need technical assistance during the webinar, please enter your tech support question in the Q&A pod. Our tech support staff will be monitoring these questions throughout the webinar and will work to answer your tech support question right away. You will receive an answer in the Q&A pod. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on cms.gov. Please note this webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in this webinar are those of the presenters and do not necessarily represent the official position or policies of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. We will have 4 panelists with us today. Our panelists include Rosie Abad from the Archie Hendricks Senior Skilled Nursing Facility. She is their administrator. We will also have Tiffany Shangru, the administrator for the Oglala Sioux Lakota Nursing Home. We will also have with us Brandy Moran, the administrator for the White River Health Care Center, as well as Deb Arbogast from the Medicine Wheel Village. Today, our presenters join us from the Unite group. Unite stands for Uniting Nursing Homes in Tribal Excellence. This is a nonprofit organization that serves to provide support to tribal nursing homes and tribal assisted living facilities, and have been doing so for about 6 years. They promote evidence-based education and training, best practices, and quality improvement initiatives, and the intent is to support tribes desiring sustainable facilities and services for tribal elders to age in place. The Unite's mission is to partner with Native American and Alaska Natives and Hawaiian tribes to improve the quality of life of elders through the implementation of evidence-based practices and culturally relevant education and training. If you're interested in becoming a member of the Unite group or are in contact with a local tribal facility, long-term care nursing home, or tribal assisted living, the contact information for the Unite group is located here. Tammy Reed is the president of the Unite group, and Ron Ross provides support to the group. Okay, and now we will transition into our panel discussion today. And before we begin with our questions, I'm going to allow time for each of the panelists to introduce themselves in their own words. And so we'll go ahead and start with Tiffany. Tiffany, do you want to go ahead and tell us a little bit about yourself?
Yes. Hello, my name's Tiffany Shangru. I'm the administrator here at Oglala Sioux Lakota Nursing Home. I have been in this position since March of 2019.
Great. Thank you, Tiffany. Yeah. And Brandy?
Hello, my name is Brandy Moran. I am the administrator here at the White River Healthcare Center. We are owned by the Rosebud Sioux Tribe. I have been as the administrator here going on in October for 3 years. I've been in long-term care for 22 years and been in different positions, and now I'm in the administration. Thank you.
Great. Thank you, Brandy. Rosie?
Good morning, and maybe to some of you, good afternoon. This is Rosie Abad from Archie Hendricks Senior Skilled Nursing Facility in Sells, Arizona. I've been in this position since 2018. I've been in this field since 1999, and so have been in various positions, and now I'm in administration. And I welcome you to this webinar. Thank you.
Thank you, Rosie. And Deb?
Hi, my name is Deb Arbogast. I am the administrator here at the Medicine Wheel Village. I've been in this position for approximately 4 years. We were an assisted living that transitioned to a nursing facility with currently 26 residents in-house. And we accepted our first nursing home resident in January of 2019. Previously, before this, I had been in various positions from consultants to director of nursing and a surveyor with the state of South Dakota.
Great. Thank you so much, Deb, and thank you all for joining us for this panel discussion. And so we do have a series of questions that we'll be running through today, and so we'll go ahead and just treat each question like a round robin, so each person will have a chance to respond to the question. So our first question is, and I'll go ahead and Tiffany, have you start us off. How are you supporting clients' mental, spiritual, and emotional health during this pandemic?
Well, here at Oglala Sioux Lakota Nursing Home, we do telehealth counseling. We did move to phase 2 just a couple weeks ago with the resident small group dining and small group activities. It's kind of like here we're just now getting to our peak with the virus, so we are starting early back in March with everybody, going to their rooms and, with the virus, and we didn't know how fast it was going to get here. We've been doing this a long time, and it's hard to not feel bad for them, and they're enjoying the small groups coming out of their rooms. They're Skyping with family. We've had a couple small group of kids come out to the nursing home in the front yard for Mother's Day and Father's Day and show them cards. There's been families that went to the windows and painted on their windows. So that helps out a lot. Thank you.
Okay, great. Thank you, Tiffany. And Brandy, how are you able to support clients' mental, spiritual, and emotional health during this time?
Currently, we're doing the telemedicine with our residents, and they seem to use the telemedicine a little bit more and talk to our providers more with using that. We also do the same thing as Oglala, where we are doing like video chat with residents and family who can. We are also scheduling where families can see residents in the windows, and we did just recently have a family group that wanted to do like religious music, and we kind of set it up outside, and it was a nice day, and let the residents, as long as they were 6 feet apart and did their social distancing, they were able to enjoy the music outside. We do spend a lot of them like to spend, we need that vitamin, the sunlight, so we take them outside quite a bit and let them in small groups and sit outside and get that fresh air, because they feel a little trapped on the inside, and not being able to see other people sometimes is harder. And then we just try to keep them accommodated with individual activities in their rooms where it's safe for them to be. And that's all I have. Thank you.
Great. Thank you, Brandy. And Rosie?
Yes, we are doing the same as what Ms. Tiffany and Brandy has mentioned, and also we have the blessings of our buildings, and of course they're on the outside, and our residents are aware when we do have our groups doing this, so they're very aware that the buildings are being blessed regularly. And we were also, back what Tiffany was saying, we were working on phase 1.5, but just like all our policies and procedures are so fluid with COVID, we are with anything that relates to being in the different phases. We may be now less than phase 1 again, because we just recently received word that one of our districts has a stay-at-home order in place, and that was just from last night. So we just ride the waves with, what's going on in our community. And as you all know, Arizona is one of the hot spots in the United States. So we are being ultra careful down here. Thank you.
Okay, great. Thank you, Rosie. And Deb?
Here at the Medicine Wheel Village, we have done many of the same things that the other presenters have talked about. One of the things that we've done that I think is a little bit unique for us is we have staff members that we compromised what we call the Corona Crew, and they do live. We do Facebook Lives on our Medicine Wheel Village page with them dancing in the halls, interacting with our residents. We've done exercise with incorporation of the music and dance, and our residents look forward to that. Our families really look forward to that. That has really boosted a lot of the spirits for our residents. They just love it. They look forward to the Corona Crew going live again on Facebook. So the virtual visits are there. Of course, we incorporate food in our daily events and highlight different things. We just did Donut Day and took pictures of the residents, posted, had our staff involved with that along with our residents. We have our garden. We share those pictures on our Medicine Wheel Village. So our residents, some of our residents actually got to be highlighted in a state newspaper here, and one of our legislators presented that in a Senate hearing to the President of the United States. So that has really boosted the morale for many of our residents because they never had those things before. So those are just some of the things that we have done, along with many of the other presenters have voiced the virtual visits and making those visits accessible to family members through Facebook.
Great. That's wonderful. Thank you, Deb, and thank you, everyone, for responding to that question. Our next question is, and Brandy, we'll go ahead and have you lead on this one. How are you supporting your staff's mental, spiritual, and emotional health during this pandemic? Brandy, are you there? Okay. So I know that she was having some connectivity issues, so we'll go ahead and move on to the next person and try to follow up with Brandy. Rosie, would you mind starting us off on responding to this question?
Thank you, Ms. Julie. So with our staff, it seems as since we've been doing this since March, of course, we've really built up on our communication and being transparent, especially with our direct line staff. If there's any testing that comes back that there's a possibility, I mean, we let them know, of course we have to let them know right away, and so just in anything, in any form, in any policies and procedures, of course, changing the transparency, of course, is so important. That goes across the board with all of our staff. So I believe at a point now that we're like, 4 months in deep, there's a trust that's being built more and more each day. We also are stressing our employee assistance program. I believe that people were aware that we had that, and now we're really going to start pushing that more and more. So then our staff, if they're not feeling comfortable with reaching out to their supervisor, they know where they can reach out to if there's any concerns. Of course, all the special meals, we have free meals for staff every day. 3 meals are free. We have special meals like steak that we have served our staff. We have given out care packages, which at one time toilet paper was a hot commodity. So we were giving out toilet paper, other hygiene products. I believe our next care package is going to include a face mask, a box of face masks, the surgical ones, so that way we can continually encourage them to use that when they're not in the building. We still are with our COVID pay, COVID-19 pay, those essential staff that are on board, they're given a weekly COVID-19 pay. Of course, we are honoring the administrative leave that's mandated, but we also have our own administrative leave when there's anyone that is sent home or has a concern with someone that may have been in contact with someone that was positive with COVID-19. Thank you.
Excellent. Thank you, Rosie. And Deb?
Hi, this is Deb. We've done, of course, the hazard pay for our employees, our direct care staff and non-direct care staff. We do offer administrative leave if anyone needs to be on a 14-day quarantine due to the potential for exposure of COVID. We have offered care packages to some family members of our residents, or our staff, I'm sorry. One of the things that we've done here is we highlighted our staff during CNA week. Of course, we couldn't do the usual party that we had done in the past, so we highlighted our staff on our Facebook page and giving them the recognition. And one of the things that I had many staff members mention is they didn't realize how much the families and the interactions with community members that they received when they were highlighted on our Medicine Mill Village page. We do fun things, games, new policies roll out all the time and changes, and it's hard to keep up to date. So we do something, it's called the COVID morale bonus, and we've done like scavenger hunts with find the clues, first to respond, know the correct COVID answer, and we've offered bonuses there. We have also, for different departments, we've done the 2020 CNA Warriors t-shirts. We've done It Takes a Village t-shirts and Essential Worker t-shirts for our staff. And those were huge morale boosters. And sometimes it's just a little thank you given on a daily basis that makes it easier, especially in a time when it's like the fear of the unknown with exposures or where we sit as a community for positive COVID. Right now, our facility remains in the no COVID zone, is what we call it, and we continue our sentinel testing. But I think just bottom line, recognizing the staff has been a huge morale booster for our employees at Medicine Mill Village.
Okay, wonderful. And Tiffany?
Yes, here at the Oglala Sioux Lakota Nursing Home, we've done a lot of similar things. We've done a few small cookouts for the staff. We had a donut day. We ordered T-shirts, and there was like the small group of kids I had mentioned that came to honor the elder for Mother's and Father's Day. They also had a Heroes Work Here. It was called Native Connections, and they had a drum group called Creekside Singers, and they came out and they did a little round dance in the front, honoring the employees here, and they also gave them a small gift of sage and sweetgrass, which was really nice. And let's see, we just praise and encourage our staff every day for doing a great job. We have been lucky so far, also that we have not had COVID in the building. So thank you.
Great. Thank you, Tiffany. And Brandy, how have you supported your staff's mental, spiritual, and emotional health during this pandemic?
We have done the same as everybody else has done. We did do pens. That was the only thing that we did different. And we did these neat little COVID pens, and the employees enjoyed those. We tried to give support to all of the employees, especially when they have to come in and they have to wear their PPE in the facility. And we also do a lot of food, but I think that's part of the tradition. Indian tacos, or we try to make a meal of the month for employees. We sometimes try to do pizza parties and Subway parties. And then we also do like little huddles for all of the employees to voice concerns, or if they have anything that they would like to add. And those are the main things that we're using for employees right now, and just being support to them. And we do offer have some mental health that they can work with through IHS, and we do recommend that if they do need that. Thank you.
Thank you, Brandy. Okay, so we're going to shift over into our next question. And so we've talked about the resident, we've talked about the staff, and the focus now will be about how have you supported the larger community that you serve and the families of your clients that have been impacted by the pandemic. And so, Rosie, we'll go ahead and have you start this round off for us.
Okay, thank you. First of all, we do have on our website, this is for our families, and this goes back to the emotional and the mental support of our residents. We have a how-to, we have several how-to videos on how to learn FaceTime, how to learn Zoom, how to learn WhatsApp, and then we are in constant communication with the Unified Command Center here on the nation. When there's any concerns, we broadcast it over our local radio station through a public service announcement. You can imagine on the administrative level, there are many of us that are on call and available always for our families, and that would include our social services, our cultural liaison, our director of support services, our DON, myself, and and so families know that they're able to reach out with any concerns they may have. Thank you.
Okay. And Deb?
Here at the Medicine Wheel Village, the support that we've been providing to the larger community, besides our family members, is we offered our CNA training program to our tribal health program, and we are helping in the community because due to the dire emergent need to get more healthcare members trained as in a CNA position, we are doing that training for our tribal health department. We also provide meals for the community members that are in a quarantine situation here in Eagle Butte, South Dakota. And then once again, for our community, which we do include that as our family members and friends or guardians of our residents, we offer the weekly update phone calls and, the virtual visits, which many of the other facilities on the discussion have voiced that they are also doing. That is what we've done here to help support the community. Thank you.
Okay, wonderful. And Tiffany?
Yes, we have our local KILI radio reservation radio show that we can, announce things on. We also do family letter updates and a Facebook page. And that's about it. Thank you.
Okay, great. Thank you, Tiffany. And Brandy?
We also do a PSA, like Tiffany was saying, and we provide information to family and to the community because we are one of the most vulnerable in our community, and everyone is very concerned about that. So I try to update them on what we're doing in the facility and the procedures that we're doing to make sure that they're aware that we are taking as much precaution as we possibly can. And the reasoning why we are doing that is and inform them and the community of this to help them understand a little more about what's going on with residents, what's going on with the world right now, especially with the COVID. We also do letters to the families. We've done letters to our residents and had informed residents of exactly why we have to do this and made them understand the importance of staying in their rooms as much as possible and why we only get to do small group activities, so that way they're aware of the consequences of them being out in the public. But sometimes they don't understand why they don't get to go on their doctor's appointments anymore, and family sometimes doesn't understand why they don't get to come up and visit, or why they can't just see them for a few minutes. We still are in phase 1, so we're restricted and we're not allowing people to come inside and visit. So those are things that we make sure that the community is informed of and make sure that they're supporting us and we're supporting them. Thank you.
Great. Thank you so much, Brandy. And it sounds like everyone's really trying to navigate this with as much flexibility as possible and even utilizing technology to a greater extent while also maintaining consistent communication with residents, staff, and family, and so that's really great. So moving into our next question, because there are so many moving pieces in regards to this pandemic, we want to ask about what are the persistent challenges that you face during this time. And so, Deb, if you wouldn't mind starting us off, that would be great.
One of the most persistent things for us here is receiving adequate number of PPE supplies. Always feeling challenged to make sure that we have enough supplies on hand. Of course, in our community here on the Cheyenne River Sioux Tribe, we do not have a large number of positive COVID, but that can always change, and we do know that. And we have no positive in our building, and we continue to pray that it stays that way for us. But that has been a very difficult challenge for us. We've been very blessed that we're not having a staffing challenge at this point. And we continue to be able to hire in key positions. But for us here in Eagle Butte, South Dakota, it has been the challenge of having adequate PPE supplies. Thank you.
Great. Thank you for sharing that, Deb. Tiffany, would you like to go ahead and share with us next?
Yes, I guess we're pretty much the same. We haven't had any problems with staffing, luckily. I guess because we started way back in March, like all of you have, the residents they were doing fine at first, but after a while, we start seeing some behaviors. Now that they're happy with the small group communal dining and activities that they get to come out for, we just have to keep encouraging them to put their masks on, move them up from below their chin over their mouth, social distancing, and they've been wanting so bad to go to Walmart. We used to take them to Walmart every other month, so they want to do their own shopping instead of sending a shopping list with somebody else. So thank you.
Thank you, Tiffany. And Brandy?
Some of the main challenges that we've had, we have had some challenges with the PPE. Gowns was one of the things that we had a really hard time trying to get and to maintain. Another thing is just trying to keep up with all of the new policies and all of the new procedures that we have to go through. Another thing that we have ran into is trying to make sure that our staff and our residents and our family are informed about the importance of staying out of hotspots, doing the social distancing, and making sure that they're staying safe outside of the facility, and making sure that we do not have COVID in the facility. So far, we have not had any COVID in the facility, but it's just taking those precautions and making sure that they're following through and making sure that we're educating our staff and our residents and our families enough. We've also had some issues with, we do have some temp employees and coming from out of state, and making sure that they're not coming from hotspots, and figuring out how they're coming here from a different state and making sure that they're taking safe precautions coming to our facility, and making sure that we're doing the COVID screening and keeping up to date with that. And some of the other challenges that we've fallen into is making sure that our employees know all of the proper symptoms and what to do, and to make sure that they're not coming into the facility and they're calling if they do have those symptoms. So those are our main challenges. Thank you.
Thank you, Brandy. And Rosie?
I believe I have like three also. It is, again, as what Ms. Brandy just stated about our staff, and having them realize the importance of source control out of the facility. For example, with, gathering with family members that are not in their household, and how many times that may be a risk. And with just the continual education of just what they do here, they need to do on the outside. Staffing, we do have a struggle with our staffing. Even with our agency staff, we are asking them to be between jobs, be between contracts, at least 10 days, and then come in with a negative result. So they have to take a test, a COVID test, and have the negative results before they can join our team. So that's also a challenge there. And then because of Arizona being one of the hot spots in the nation, then testing results are now taking longer. We used to be able to receive them in a couple of days, and now it's up to 7 days. And so because everybody in Arizona is testing. One of the things, though, besides the challenges that I've seen, and I believe everyone has seen this too, is where it is a mixed blessing, where I see staff that we have placed, and that includes all of us, of course, that we've been placed in an area out of our own, we're stepping into something that's out of our own comfort zone. And I see where staff has grown. I've seen where they've gone up and beyond, expectations. And so I see a real growth with what's also happening with the struggles of COVID, and always constantly battling and making sure that our nursing home, our residents, do not have COVID. But that reminds me of a quote from Ernest Hemingway that says, "There is nothing noble in being superior to your fellow man. True nobility is being superior to your former self." So we also, with the challenges, we need to celebrate our own growth. So thank you.
Great. That's wonderful, Rosie. That's a perfect segue into our next question. Everyone has seen challenges, and at some challenges, there's a way to kind of work through those challenges. And so this question focuses on what are the innovations or improvements your facility has adopted during this time. And so, Tiffany, if we could go ahead and have you start us off, that would be great.
Okay. Excuse me. Yes, probably the same with all the other nursing homes is one of our greatest improvements is our infection control, more strict hand washing and teaching PPE, donning and doffing, and disinfecting really well and thoroughly, and monitoring staff illnesses. Thank you.
Thank you, Tiffany. And Brandy?
So the month of June was the first time, and I do not remember for our facility that we actually had no infections. So that puts a lot into that. We are implementing, making sure that the employees are doing their infection control, and they are, because it's showing in their performance. So we did a great big appraisal to all of the employees for doing such a good job with the infection control. We also ended up going through 2 infection control surveys through the state, and we had 0 deficiencies with both of them. So we were very proud and appraisal of employees and staff because they did so well during the surveys. And we haven't had COVID in our facility. That's a huge landmark, that we don't have the COVID, and the employees are keeping it out of the facility. So what we're teaching them is working. The residents, they are getting lonesome, and they are getting tired of this isolation, but they're safe, and that's a huge improvement too. So those are some of the things that I think we can be proud of. Thank you.
That's great. Thank you, Brandy. And Rosie?
I must also agree with our infection control program has become more and more structured, it seems, with every single day. I sometimes, with it being so fluid, it's like a chaotic structure, but we ride with the waves. We also in our building hardly have any infections, so that is a direct result of our program. And I have seen a tremendous growth in our technology savvy, because we're not able to gather as we used to for stand-up clinicals, all the meetings that are in any building. Of course, we are becoming more savvy in using Zoom and using Teams, and I believe anything that will be available to us, we're going to be able to approach it with more of an open mind and saying, oh, yeah, we can do that. And eventually, with all this will lead to our own residents, our family members, and even the community at large being more, IT savvy. So, thank you.
Great. Thank you, Rosie. And Deb?
Hi, here at Medicine-Will Village, of course, our infection control is one area that we've seen vast improvement in, with the hand washing, the donning, doffing, staff understanding difference between quarantine, isolation, those areas. But we had to become quite innovative in how we were going to do and meet the needs of our residents with their daily activities and restorative exercise program. Each one of our wings are separated by a nurse's station or a long hall. So we've incorporated more of the electronics, the iPads, the tablets, the smartphones in our facility, Zooms, conference calls, Skype, Facebook Lives, innovative. So we really looked at our restorative program and our activity program, and how could we make this work on a daily basis? So each week we meet with our nursing staff, mainly our nurse aides, our med aides, our restorative aides, and we are completely renovating that program to we call it an RRTA, a Recreational Restorative Therapy Aid Program. We are training and interviewing our nurse aides that are interested in becoming one of the RRTA aides in this program. We are also upgrading our TV system to go along with this, with retirement home TV, which will allow us to have an in-house channel to broadcast some of our exercise programs, our activity programs, and even if we are meeting in a small group of 4 or less, we'll still be able to broadcast it over that. So we found that we have become much more tech savvy in our facility. We also included some of our med aids in our telehealth implementation over on our assisted living side, and working hand in hand with our nurses and increasing the training availability for our employees to promote a more psychosocial program in our activities and our restorative, combining them into one, into the RRTA, using tablets, our television, local television channel, and basically just assuring that our residents' needs are being met, both spiritually and physically, and socially, because we don't know the unknown when lives will change, when we will open up our facility to family members, one-on-one visits. So that's one of the things that we are actually very, very proud of in our facility is our Tech Savvy program, we call it, with the RRTA, and training our staff and increasing our knowledge base overall in not just one area, but in the activities program and in the therapy program. And we're really excited to get into our final stages with that. Thank you.
That is great. Thank you so much, Deb, and thank you all for responding to these questions. You all have done so much to support your facility, your staff, your residents. It's really great to hear all the things that you're doing. That was the final question for our panel discussion today. So we'll go ahead and take some time to have questions from the audience. But however, before we do that, I just want to quickly review contact information for the Unite group. You can contact Tammy Reed, and I apologize for you can't really see the addresses, so I'll go ahead and put those in the Q&A, and you can contact either Tammy Reed or Ron Ross if you're interested to learn more about the Unite group, or if you have information about a tribal nursing home or assisted living facility that might be interested in joining the Unite group, they can certainly assist with that process. Okay, so we'll go ahead and take questions and or comments from the audience. If you have a question for one of our panelists, please type that into the Q&A pod located at the bottom right side of your screen. So we'll wait a few moments to allow folks time to type in their questions. Okay, and while folks are typing, we did put that contact information in the audio information pod towards the bottom. So Tammy Reed's email is tammy.reed@unitenatives.org, and Ron Ross is ron.ross@unitenatives.org. And again, if you have any questions for our panelists, please type that into the Q&A pod. Okay, and one question I have for each panelist is, what resources have you found to be most helpful for you during this time? And Deb, I'll go ahead and ask you first.
One of the resources that I find is the most helpful for us here is our Tribal Health Committee members, and also we have weekly calls with the state of South Dakota, and they give us updates, and then they're always available. You know, they're just a phone call or an email away. That, I think, has been one of the things that I've really enjoyed is our state of South Dakota having update calls 1 to 2 times weekly. Thank you.
Great, thank you. And Rosie?
I would say our Arizona chapter of ACA, our Arizona chapter of Leading Age, and of course the Unified Command Center. Thank you.
Okay. And Tiffany?
I find Panhandle Public Health, our public health department is one of our greatest resources.
Excellent. And Brandy?
Part of ours would be the Department of Health, like Deb said. We do have those weekly meetings. Those are very informative, and we go through the South Dakota Healthcare Association, and they post 2-3 times a week of any kind of updates that are mandated through CMS, the state, CDC. Also going to the CDC and the CMS website. Those have been very informative also. We do have the compliance store also for all of our policies, and that kind of helped us get our policies in order, and they kind of give you a template and assist with that. And then we've also worked with IHS and also the tribe. In our management group, Rural Health Development or Native American Health Management has been a huge influence. We do have a nurse consultant that also helps us at times too. Thank you.
Wonderful. Thank you so much. And so I also wanted to just leave it open to our panelists if there are any last remarks or comments that you wanted to make, or any additional information that you wanted to share. I wanted to go ahead and just leave some time for you to have some closing remarks.
Hi, this is Deb at Medicine Wheel Village. I think that one of the biggest things in this COVID pandemic that we have experienced at our facility is I've seen our staff and our residents bond deeper than they did before. We realize that we are the family that they get to see on a daily basis, and we try so hard, and I've seen some of our staff members, along with one of the other presenters mentioned, their growth has just been so immense in this trying time for all of us, for our residents, our families, our staff members, their families, and just becoming more of a family and that deep, deep bond in our building. We are a smaller facility, but just, you know, the times are tough right now, and everyone being so supportive of each other. Thank you.
That sounds wonderful. Thank you, Deb. Rosie, Tiffany, or Brandy, did anyone else have anything they'd like to share?
This is Brandy.
Rosie. Oh.
Go ahead,
you want to go? Okay, just really quick. Also back to where, you know, the people, even around us, on how they're growing, even the communities and the cities that surround Archie Hendricks Senior Skilled Nursing Facility. You know, that we have Pima Cares and Mercy Cares, and those are, I guess I could call them easily love letters to our residents and to our staff. Honoring the staff that works with the residents, and telling the residents, hey, we're here for you. We know you're there. Please write back if you would like to. So communities that are coming together, knowing that our residents and our staff need that warm fuzzy. So yes, I'm not just seeing the growth here in the facility, the staff, and on our own residents, but just the communities around us. And I just think that we as human beings, when it gets tough, you know, the tough get going, and we're going to get through this. We're going to get through this, and there's going to be a lot of lessons learned, and we'll be ready for if and when there's something similar like this. But we'll be ready, and I guess we just continue going forward. Thank you.
This is Brandy.
Thank you, Rosie.
Sorry. The only thing I was going to bring up was kind of like Deb and Rosie both said, is that our employees, they have, we've worked on a bond where we have become a team, and keeping up with all of the updates has made us a lot closer as a team, as how we work and who does this and who does that. And I think that going through this pandemic has made us grow as employees and as a facility. So that was the only thing that I was going to bring up. Thank you.
Okay, and this is Tiffany, and I just wanted to say that I'm really proud of my staff also, that they're all doing such a great job, all my department directors. I'm just proud of everybody, and I'm thankful that we're able to keep COVID out of here for now, and I hope that continues. Thank you.
Wonderful. Thank you so much. All right, I would now like to thank our Unite Group panelists for joining us today and sharing information about how their facility administration and staff are caring for residents, families, and communities and doing their best to stay flexible and maneuver through all of the challenges coming their way through this pandemic. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov on the Tribal LTSS Technical Assistance Center website. Thank you again for joining today's webinar. Our session is now concluded.